Hello everyone, and welcome to another episode of Ask Dr. Bob. And I had an individual that had her uterus removed, and because of her uterus being removed, she's been dealing with some hot flashes. She's been taking a nutritional product from someone that she saw on the internet or TV program and wanted to know what should she be doing right now. Now, let me tell you this. The first thing is that you want to have some testing done. And we use saliva testing in our practice. You may consider having a post-menopausal saliva test done just to see what's going on in the hormones in your body. There's a gland called your adrenal glands, and the adrenal glands help make estrogen. They help make progesterone. And if you still have your ovaries will help make progesterone and other hormones also. So step number one, I would consider having a saliva test done. For sure, have a thyroid profile done. Have someone take your blood pressure from sit to stand. I know you specifically want to know about flax oil. Flax oil is definitely a good idea. 1 tablespoon per 100 pounds. But even individuals that I've seen in our practice can overdo it on flax oil, and they might take too much and have an issue. So you may consider having an essential fatty acid blood spot test done to you. I would eliminate all sugar from your life. All sugar. Sugar compromises your adrenal glands. So I hope that helps make a difference. We have found that hot flashes improve with iodine. The next question was someone that had their thyroid taken out, and Dr. Bob, I want to know if I should be taking iodine as a supplement. What I would encourage you to do is have a thyroid test done. A TSH, T3, and a T4. Why? So you could have a plan. You need to have markers to create a strategy. Chances are you're on a product called levothyroxine or Synthroid, which happens to be T4. That's TOM4. Well, T4 is inactive thyroid, and it needs to be converted to T3. A TSH, a T3, a T4 serum test would help me help you. Now, there could be other issues like are you absorbing your proteins, etc. So you want to have some testing done. I may encourage you to get Dr. Bob's Drugless Guide to Balancing Female Hormones, because it will help create a strategy. It's all about creating strategies and markers to help you make the right decision of what you should and shouldn't be doing. Dr. Bob, I have been taking statins, and I watched your video on statins, and I want to know about familial hypercholesterolemia. So you can say, Dr. Bob, what is that? Well, that's an individual in a family that may have high cholesterol. Well, we're going to be releasing a short clip soon on the Week in Health, and the Week in Health is going to be on the article from the Wall Street Journal, which I'd encourage you to do a search on. It's going to be called Fat Reconsidered. In this article, they talk about a lot of people are very concerned about their cholesterol, and a lot of information really has been skewed the last 50 years. If you're a female asking me that particular question, you may reconsider the statin drugs. I would encourage you to follow Dr. Bob's ABCs. A half a red apple every day, a 1/3 cup of beet fiber, and 1 medium carrot. That will help stabilize and lower your cholesterol. But let me share this last nugget and thought with you. If your cholesterol is elevated and your triglycerides or your blood fat are normal, chances are your cholesterol is elevated because of stress, and the statin drugs probably will not help you. So I'd like you to do a search on Fat Reconsidered. It was in the Wall Street Journal. There was information recently released in the Annals of Internal Medicine. My name is Dr. Bob DeMaria. Thank you once again for following us on Ask Dr. Bob.